Good morning and welcome to the Thursday, January 21st, COVID-19 Response Media Briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel for today, Secretary of Health, Dr. Umair Shah, MD, MPH, with the Washington State Department of Health. Michelle Roberts, Acting Assistant Secretary, Washington State Department of Health. Dr. Elizabeth Waco, Chief Operating Officer, Swedish First Hill. Dr. Scott Lindquist, State Epidemiologist for Communicable Diseases with the Washington State Department of Health. And Lacey Fehrenbach, Deputy Secretary of Health, Department of Health. To begin today's briefing, we'll open with remarks from Secretary Shah.
Hi, Frangie. How are you?
I'm good. Thank you, Dr. Shah.
Great. I'm having some trouble with my video. Apologies. I'm going to try to fix that in just a moment here. Give me one sec.
That's all right. Thank you. We've got you now.
Perfect. Thank you so much. All right. Good morning. I wanted to, first of all, thank you for being here this morning. As we all know, today marks the 1-year anniversary since Department of Health announced the first confirmed case of COVID-19 in the United States here in Washington, just north of Seattle. The state began its fight against COVID-19 1 year ago before anyone else, and our transmission rates and disease spread have been one of the best in the country, which certainly has been comforting. However, we have a lot of work ahead of us. The reason that we have done so well over this last year is because people around this state have been wearing their masks, watching their distance, washing their hands, and getting tested, along with all the incredible and tireless work of our public health and healthcare partners on the ground. It has been a long year with, unfortunately, many lives lost and so many people impacted. Everyone has experienced effects of this pandemic, whether from the virus itself or as a result of measures needed to slow down the spread. As of yesterday, our state had seen over 280,000 confirmed cases of COVID-19 and unfortunately 3,940 deaths from COVID-19 as well. In recognition of this immense impact in this long year that all of us, not just in the state of Washington, but across the nation, have experienced related to COVID-19, today Department of Health will be holding a moment of silence for all those who have been impacted and those lives that have been lost to COVID-19 in our state and beyond at noon today. We encourage others to join us or take a moment on their own today to reflect on all that has occurred this year and on those lives that have been impacted. Well, we're all tired of this pandemic and everything that's gone along with this pandemic, including the steps that we've all had to take together. The pandemic, the virus, is simply not tired of us. As you know, on Monday, Governor Inslee announced new measures to expand our vaccination efforts. We moved into phase 1B1. We set a goal of vaccinating 45,000 people a day and launched not just Phase Finder, but the next day, a vaccine dashboard, tools to help people understand where they're eligible for the vaccine, but also how much vaccine is being administered within communities across the state of Washington. We also announced new partnerships and multiple high volume vaccine sites. As you know, these high throughput sites throughout the state of Washington, and partnership with our local health partners, whether in the healthcare system or whether in the public health system, continue to allow us to have forward progress, the forward progress that is needed to assure that we get Washingtonians vaccines as quickly as possible, and that we do this in a way that is equitable as well. We also know that earlier this week, just yesterday at the national level, we have a new administration that was sworn in, and we have high hopes for new effective federal leadership in the fight against COVID-19. More support in efforts at states and localities across the country to not just fight COVID-19, but also to get vaccines out faster. Reliable information, accurate information, and timely information is not just important for our community members and our localities, but also for states across the country. And we welcome the opportunity to work with the new administration in these efforts. We made all these changes and made these announcements earlier this week because we know that getting more people vaccinated faster is the goal for all of us. That's what all of us want, and that's what is necessary to get Washington out of this pandemic as safely and quickly as possible. Even as we roll out life-saving vaccines, unfortunately, we must also remain on guard. So even if you receive a vaccine, we recognize that you still have to wear your mask and wash your hands and watch your distance and get tested and do all those things that are going to help us, again, prevent further transmission. You're going to hear from Dr. Lindquist and Michelle Roberts later, as well as Lacey Fehrenbach. What I wanted to also recognize is our data continues to show that we have high levels of COVID-19 activity throughout the state, and we continue to have signs of a recent uptick, which is certainly concerning. At the same time, we're seeing new variants of the virus across the country and the globe that may spread more easily, and it's just a matter of time before we start seeing those variants in the state of Washington. All this means that we have to do everything we can to vaccinate as many people as quickly as possible, and also make sure the other measures we need to have from a prevention standpoint to control the virus, again, wearing masks, washing our hands, watching our distance, getting tested, and working with our healthcare partners remain just as critical as they were before. If anything, we need to intensify our efforts in order to maintain and build on the progress we made in the late fall moving forward with reopening. Until this pandemic is over, we will need to continue these measures to save lives and protect our communities. It's going to take all of us to make this happen. And together, though, I'm confident, and all of us within state government are confident we will succeed. Our goal is 45,000 vaccines a day. We are about a third of that. And we know we do not have enough supply of vaccines coming into our state. But as the governor announced on Monday, we're doing everything we can to build the capacity for 45,000 vaccines a day to be able to be delivered. So when those vaccine supplies start to increase, we are ready, we're focused, and we can get vaccines out as quickly as possible. So with that, I want to thank all of you again. I want to remind you again of the 1-year anniversary, which is a sobering reminder of how devastating this pandemic has been in our state, in our communities, and the lives that have been impacted for Washingtonians across this great state of ours. Thank you for all your hard work, but we want to make sure that you recognize that we are not out of this pandemic yet, and we have to keep it up. With that, Frangie, I'll turn it back to you. Thank you.
Thank you, Secretary Shah. Next, we'll go to Assistant Secretary Michelle Roberts.
Good morning, everybody, and thank you, Dr. Shah. It is definitely a somber day. Our heart goes out to everybody in our state and across the nation and really across the world who's lost family and friends to this virus. And that is why we're working so hard to quickly get as many vaccines out as we can to really hope change the course of this pandemic. So once again, I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution for the Department of Health. I want to start today also by acknowledging the resilience of our vaccination partners who have adapted so well to a variety of challenges. We are so thankful for their commitment and hard work as we work to improve the process together. There's been a lot of changes and people are being incredibly flexible. As you've heard, we've been eager to pick up the pace to get vaccines to people who need them. And we know you are too. Today, I'll share some updates about the progress we've made and what we hope to accomplish soon. So let's start with some numbers. As of January 18th, 335,000 total doses of vaccine were given in our state. That includes both the first and the second doses. That's the same number, and the detailed number is now on our dashboard every day. We have also received a total of 820,875 doses that have been delivered to our state as of January 20th. That number is slightly more than is on the dashboard right now, and that just reflects that vaccine is coming into the state every day. This week, we will receive 93,300 doses of vaccine for first doses and 142,625 doses for second doses in our state. On the dashboard, you can find state and county level data, which we'll talk about more in a moment. So the number of vaccines given to the people of Washington is growing larger by the day. We're confident these numbers will continue to grow now that we're in phase 1B, tier 1. That means more people are now eligible to receive the vaccine earlier than originally anticipated. We've also seen vaccine provider enrollment continue to grow. That means as we get more vaccine, there will be more places for people to receive it. So let's review some of the big changes we're putting into place to bolster vaccine distribution statewide. As you know, our goal is to build infrastructure to ensure we can vaccinate, or so that we can give 45,000 doses of vaccine per day. That number is both first and second doses. To do that, we need to receive more than 300,000 vaccine doses per week. We are not getting that many yet, but we are working hard to build our capacity to reach and support that goal. Our expanding efforts include a new public-private partnership model as the state coordinates with Starbucks, Microsoft, Kaiser Permanente, Costco, CMAR Community Health Centers, labor groups, and the National Guard. Each of these partners will bring their expertise to help realize our commitment to deliver vaccines as quickly as possible to all Washingtonians. Also, the Department of Health is moving quickly to make Governor Inslee's vision of regional mass vaccination locations a reality. The work has already begun by making personal contact with each of the selected local health jurisdictions to find a collaborative solution to have mass vaccination clinics delivering vaccines next week. The goal is to open 4 mass vaccination clinics across the state, and those locations are Wenatchee, Tri-Cities, Spokane, and Ridgefield in Clark County. We're also ensuring vaccine to support local mass vaccination efforts in Snohomish, Pierce, and King counties. These clinics together should have the capacity to vaccinate more than 100,000 people per week, again, when we have that many doses. On the vaccine dashboard, we want to create transparency around all of the work and the state's progress in the vaccine effort, which is why we launched the state vaccine dashboard on Tuesday. This was done in partnership with Microsoft, and we're so thankful for their support in adding these vaccine tools to our main COVID dashboard. You can find that on our website at doh.wa.gov. And finally, we will vaccinate as many people as possible in phases 1B and continue to offer vaccines to everybody who's eligible in phase 1A. And we'll do that with as quickly as possible with the doses we have. And we will be able to quickly ramp up distribution as more vaccine becomes available. We are asking people to be patient as those supplies increase over the coming weeks. In the meantime, there are still important things you can do as we continue to deliver vaccines to Washingtonians. All of us can do our part to reduce the virus's spread. So wear your face covering, watch your distance, and wash your hands. Thank you.
Thank you, Assistant Secretary Roberts. Now we'll go to Dr. Elizabeth Waco.
Good morning, and thank you, DOH, for having me here today. I'm Dr. Elizabeth Waco, Chief Operating Officer at Swedish First Hill. So I just hope to give you a general COVID update from our perspective and a little bit of a vaccine update. So in the Swedish system, we continue to see a decline in patients, and that is what we would have predicted. After the first week post-Thanksgiving, and then the second week in January post-Christmas and New Year's. However, due to a high rate of compliance, we did not stretch our capacity. So that is fantastic for us. And we do want to thank you, all Washingtonians, for doing your part. It was due to you that our systems were not overwhelmed. And honestly, we cannot thank you enough. That has allowed us to turn our resources towards delivering the vaccine. So a quick vaccine update. As everyone's aware, the vaccine rollout across the state and the county has not come with some challenges. However, we've been delighted to be a partner in getting shots into arms, and we see this as the first step to getting back to health and to economic stability for our community. So I'm proud to share that by the end of the day today, we will have administered almost 38,000 doses, including 12,300 doses at our Seattle U clinic that just opened a week ago on January 12th. It was really a Herculean effort. We want to recognize and are incredibly grateful to those who have made the community vaccine possible. Both the staff and the volunteers should be incredibly proud. We've had hundreds of volunteers, both clinical and non-clinical, from the community that have contributed their valuable time and energy, and for that we are incredibly grateful. So as Dr. Shah stated, today honors the one-year anniversary of the first identified case of COVID-19 in our state. We've been through a lot since then, and we did it all together. But with the vaccine here, we're definitely seeing the light at the end of the tunnel. With the governor's announcement of moving to phase 1B, tier 1, we're looking forward to serving an even broader group of individuals. In light of this, we are working on a mobile community clinic so we can serve our vulnerable populations that have been most affected by the pandemic. So I just want to thank you for giving me an opportunity to give you an update from the Swedish perspective.
Thank you, Dr. Waco. And now this brings us to the Q&A segment of today's briefing. Our first question comes from Simone at Q13.
Hi, thanks for taking our questions. I have a couple of quick hitters, which is that I don't see on the dashboard the total number of delivered doses. I was wondering if I'm missing it or if that's yet to be added. In addition to that, the state continues to slip compared to other states in the list of the percentage of doses being distributed. We're now in the bottom third. We were in the bottom half before. I'm just wondering, how are we getting worse here when it comes to distributing the percentage of doses? And specifically list what you will be asking the Biden administration to do to help you get better at vaccinating our public, please. Thank you.
Thank you, Simone. Let me take on the second question first, and then I'll ask Michelle to weigh in on the first question in terms of the vaccine dashboard. So a couple of things. One is, it is absolutely critical for us to get vaccines out as fast as we can, and we're all focused on that. And we've had very long hours, day and night, weekends to do whatever we can to work with our partners. We have been working with also now our business community, as you know, Governor Inslee's announcement from earlier this week, so we can continue to work through any logistical hurdles or impediments that we may have, and work through all sorts of other challenges around communications and technologies, et cetera. I don't like to do the comparisons across the country when it comes to vaccines, and the reason is that every community, every state has had different host of challenges. I would say that we are making incredible progress. 2 weeks ago, when I had the first press briefing about this, we were in the 20s, and then last week we were in the 30s. This week we're in the 40s. Terms of percent, but we want to be as high as possible. And so whatever we have done is not enough, and we need to continue to do things. We do believe with the aggressive steps that we're taking, including the standing up the mass vaccination throughput sites for locations across the state, supporting our local partners in the Puget Sound area, as well as working with our healthcare partners, that we are going to continue to make progress. And so there are a lot of things that we've also are doing behind the scenes, as the governor announced as well, with requirements for our providers And I do want to thank our partner at Swedish because our partners have been fantastic in helping get vaccines administered. But the truth is that we have a lot of work still to do. And we are going to continue to do that work and not rest until we increase the number of vaccines that are delivered to Washingtonians. We're not there yet. And that's the honest truth about where we need to be. And that's why we continue to work through all those challenges that are there. The other thing is that when as we are now in 1B1, we also recognize that also adds another host of challenges, logistical and otherwise, for how we move from healthcare workers and long-term care facilities to the general public. And that also means that there are a host of additional challenges that we'll have there. And then certainly as we move down the various tiers of 1B, we'll have additional challenges. So what I'm trying to lay out is that we are going to have challenges throughout. And so the one thing that we have been very clear that we are looking forward to from this new administration is just transparent information, as much information as we can get upfront. We have specifically asked for a better insight into the vaccine supply that's coming into our state, not just the few days before, the week before, but weeks before. So we want to specifically have a more insight into what the vaccine supply that is coming into the state of Washington for weeks ahead, which then allows us to do planning at the state level and then lets all of our partners at the local level also plan. And that has been an incredible challenge. We recognize that there are going to be, as soon as you snap a finger and you change an administration, that does not mean all of a sudden there aren't going to be more challenges. But what we're looking forward to is just having a transparent understanding of what those challenges are at the federal level and the national level that are going to then allow us to do our job at the state and local levels better. And so that is what we are looking for. Obviously, there are a lot of other things that we can talk through related to CDC and leadership at CDC and other parts of federal agencies. But I think the key message is that giving us as much intel on what's coming down the road in advance, as much advance notice as possible, lets all of us do our job better. And that's what we're looking to do, is to make sure that we have efficiencies in our planning processes and implementation of those processes. Michelle, you want to take on the dashboard question?
Yeah, it's really important when you're looking at the dashboard to get the full vaccination picture. You need to click on the vaccination tab at the top. So if you're only looking at the current status, it just has the number of vaccines that are given. But if you click on the vaccination tab, you can find much more detail and some of the data broken down.
All right, thank you. Our next question comes from Carolyn Bick with the South Seattle Emerald. One moment. Go ahead, Carolyn.
Hi there. Yeah, thank you so much for taking my question. Please bear with me. It's a slightly longer one. I wanted to ask because I'm a little confused as to how the vaccinations in the state's prisons are working. And I haven't been able to clear this up with anyone from the DOH's media team. On one hand, the Department of Corrections put out a press release on December 29th that specifically stated that the only incarcerated people who will be offered priority vaccines are incarcerated in Coyote Ridge Correctional Sage East Unit. The press release said that these guidelines were reviewed with the Department of Health. And additionally, according to the Department of Health's vaccination timeline, most incarcerated people still won't be getting vaccinated until phase 1B tier 4 in April. However, on December 28th, the day before the Department of Corrections press release, a spokesman review reported that incarcerated people and guards at Airway Heights, which, as we know, saw a massive outbreak, were also being offered vaccines and that vaccination was already underway there. This happened before the change in vaccination guidance announced a couple days ago. So my question is twofold. How exactly are the vaccinations working within prisons? And given the close congregate settings in which incarcerated people live and can't get out of, coupled with the mass outbreaks we are seeing in prisons not only in the state but across the country, is the Department of Health considering moving up all incarcerated people into an earlier phase of vaccinations?
Great questions. I think I can start here. And There is vaccination happening at all of our correction and jail and prison facilities across the state. And that's really, we are giving vaccine allocations to them in alignment with the groups who are eligible. So in 1A, the Department of Corrections and other facilities begin getting vaccine for all their staff that are working in a healthcare setting or dealing with any piece of kind of detection and control of COVID within their facilities. And then as we continue to move into the next phase, that will include more groups of staff or we move into later tiers, and obviously any staff or people who are incarcerated who are over age 70. Over age 65 in alignment with these new tier recommendations. What we're doing, because we know there was a lot of people and you're recognizing an important population where there has been some significant outbreaks, is one of the other pieces that we announced on Monday is flexibility when we move to the tier 1B, tier 2 through 4 groups, so that if there's logistical reasons why it makes sense to increase throughput or to have a vaccination clinic, that you could combine tiers of people at the same time. So especially for like a setting like corrections or other workplaces, that if you're going to have a vaccination clinic, you could vaccinate all eligible people at the same time in those tiers B2 through 4 versus taking them one at a time. So that's what's going on, and we continue to work closely with all of our correction partners. And if you want to know more about the disease outbreaks that are happening there, I'm sure Dr. Lindquist could speak to
that. Dr. Lindquist, do you want to make a comment about the facilities?
Yeah, so a couple things, put it in perspective. I was on the team that diagnosed the first case in the United States. So I have been here since the very beginning. And one of the partners that has been here since the very beginning has been the Department of Corrections. And I have been out to every single facility in Washington State that Department of Corrections is, and they have great testing capability. They have very limited isolation and quarantine capability, but they're doing the best they can. This is obvious a congregate setting and becomes a real risk for disease transmission. So while there are Herculean efforts put towards testing, isolation, quarantine, the light at the end of the tunnel here is what Michelle just outlined, and that is the vaccination of people according to the tiers. So obviously, prison guards and healthcare workers that deal with prisoners, that is a great start, and those 65 and older. The one specific example you used of the safe place at Coyote Ridge is actually a nursing home within the prison system, and I have been there personally, and I am thrilled they're vaccinating. But that also fits the same criteria that Michelle talked about. So while there is ongoing efforts for disease control, as you asked, I think our real efforts are what Michelle outlined here, is that we start moving towards vaccinating the populations as we're able. It all comes down to we need more vaccine.
Frangie, the only other thing I would add to what Michelle and Dr. Lindquist just mentioned was that we are planning, as we get through about half of the 1B1 population, the 1B tier 1 population, which again, reminder is those over 65 and those over age 50 who reside in multi-generational households. As we get about 50% or half of that population done, we are, again, this is weeks away, but the plan is to be more fluid as we go to tier 2, tier 3, and tier 4 of the 1B phase. And so that includes the question about how various entities may look at incarcerated populations, either the inmates themselves, the staff themselves, and how that would all work together. But our goal is to be more fluid as we get into those later tiers after, obviously we're sufficiently through 1B1. So just wanted to add that as well.
All right, thank you. Our next question comes from Ariel Dreher with the Spokesman. Go ahead, Ariel.
Great, thank you. I have two quick questions. First, do we have any indication from the federal government when our doses might pick up? Is that in a couple weeks, in a month? Do we have any indication from them? And then secondly, are we asking vaccine distributors and healthcare providers to continue to hold on to second doses, or has the Department of Health changed that directive so distributors are supposed to use all their supply and sort of, when second doses come, they come?
Ariel, I'll take that first question and then have Michelle address the second question. We do not have yet a timeline from the federal government. We're anticipating as they continue to transition this week into next week that we'll hear more information. I was on a call with state health secretaries earlier this week, and all secretaries across the country are asking a very similar question. When are we going to get more information from the new administration? We do not have a clear timeline of that, but we anticipate we're going to hear more over the coming week or even couple of weeks. We anticipate that they have heard the feedback from all the states, which is pretty much similar. We want to get more advanced information of how many doses are going to be allocated for our state and what that looks like for weeks ahead, but we do not have a good indication on when that's going to happen. We can suppose that it's a couple of weeks away. It's certainly not this week for next week's allocation, but we're hopeful that over the next couple of weeks, we'll start to see some additional intel related to that. And Michelle, if you want to address the other question.
Yeah, the other question was around second doses and the guidance. We're continuing to make sure this message is clear to our healthcare system partners because we recognize there has been some confusion. So the second dose allocations and ordering are happening on a different schedule from the first dose. And so we are getting a first dose allocation from the federal government and a second dose allocation. And we're using those second dose allocations to match where the first dose allocations went, either 2 weeks prior for Pfizer or 3 weeks prior for the Moderna vaccine. So those are separate allocations. It's the same vial of vaccine, but they're coming at 2 different times for 2 different purposes. The requirement, the new requirement for providers is that they use all of their vaccine, including first and second doses, or using 95% of their vaccine in the week they receive it. We recognize it's going to take a little while longer to align the second dose providers have in their refrigerators already to that requirement, and we have given them a couple more weeks to do that. And the reason why it will take longer is because those first dose allocations were spread out over multiple weeks, and so we really need the second doses to be given on that same schedule. But going forward, we're working to align both in the first and the second dose allocations that providers will use everything they get, or 95% of it, in the week they receive it. And that's just really one of the strategies to help us increase throughput of the amount of vaccine we have in our state and making sure it's getting into people's arms to provide protection.
Our next question comes from Sam with KEPR. Go ahead, Sam.
Yeah. Oh, thank you so much. I just had 2 quick questions. One was just kind of a little bit more information about the mass vaccination sites, kind of just what they're going to look like, when they might open, kind of what people in the community need to know about these sites and who's eligible to go to them.
Thank you, Samantha. And we are working on this as we speak for mass vaccination sites across the state. In Spokane, I'm going to pronounce it incorrectly, Chelan, did I have that correct? Benton, and down in Vancouver, Washington. So there are four sites that we have that we are working right now with our partners across the state, including the Guard, the State Guard, as well as working with our local community partners. When things move fast, nothing is perfect. There are always impediments. We are working behind the scenes with all the logistics, with the planned opening for Monday for those 4 sites. But I will say that in advance of those 4 sites, the other piece of this is the communications to the community. And that's also what we are working on as well. We have not launched that or sent anything out yet because obviously we're still finalizing the plans. Monday would be when we would, the plan right now, unless something changes, is that we would be giving the first vaccine into the arms of Washingtonians at each of those 4 sites. But that said, there's a lot of work that needs to be done in advance to make sure that that is happening successfully. We do believe that there's likely a ramp-up period of time where we would take a couple of days, maybe even a week, to continue to make sure that our throughput is strong and appropriate, that our processes are strong and appropriate, and that all the activities related are strong and appropriate. And as we now have that over time, then the potential is there for increasing the number of vaccines that are delivered there. But the plan is for Monday, and that's where we're working towards, unless something happens that we do not foresee right now. Lacey Fehrenbach has been working tirelessly with her team on this, and Lacey may have some additional comments. But we're confident that by Monday we'll be able to get started. And again, the key for us is to not just have those 4 sites, but also to support the mass vaccination efforts that are occurring in Snohomish, Pierce, and King counties as well. So we really do want to recognize that it's all of us together, local partners as well as state partners, and then certainly even working with our federal partners all throughout the system to make this successful. Lacey?
I think you covered that well. We do expect vaccine to arrive in early next week, so including on Monday morning to these sites. And then the question on eligibility, we're really at this point in our state focused on 1B1. So those people that are in 1B1, and remember the eligibility for vaccine is like airplane boarding. So that, if there are folks left from 1A that have not yet been vaccinated, they would continue to be eligible as we move into 1B1.
All right, thank you. Our next question comes from Keith with Como.
Good morning. There was a record-breaking hearing yesterday from Secretary, as part of it. Just Deputy Secretary, excuse me. The people with the restaurants are in mass asking to be allowed to reopen within indoor dining, and the fact is 1,600 signed up to testify, 1,500 in favor of that. They point out that even though the numbers of cases and hospitalizations have been on the rise over the holidays, the restaurants have been closed during that time, and they say they're not to blame for that. They are asking that, Washington is 45th among the states in doing well, but the 5 states ahead of Washington are allowing indoor dining. Why don't you recommend to the governor that he allow indoor dining?
Yeah. Thanks for that question. Indoor dining has been a challenge throughout this pandemic. We do know because of the environment, it's not a fault of anyone. It's just the way the environment is, that it's an indoor setting. You tend to have customers who, unfortunately, for the time that they're there, they're usually seated next to each other or very close to each other within 6 feet. And because people are eating and drinking, you have to bring your mask down, and that increases risk. Now, whether that risk translates immediately into numbers in the system, that can be challenging. And so I would say that it's not a, you do X and immediately you see a result right down 2 or 3 weeks later. It does get complicated very quickly. But the reason is because we do believe that there is risk in these establishments, not just restaurants, dining, but also bars, et cetera. We continue to look at the data on a week-to-week basis. As you know, the Roadmap to Recovery is released on every Friday, and looking at that roadmap, We have come up with a phased approach, and we're currently in phase one, but hopeful that we, especially in some communities, some regions, I should say, will be able to get to phase two as quickly as possible. But ultimately, we want to be as careful as possible, because what we have seen in other parts of the country is that if you do dial up various entities too fast or too much, or across the board, you can start to see increases. And unfortunately, we have enough transmission that's occurring in our state. What we don't want to have happen is then try to dial back, but now it's too late, because we've already had the transmission increase already occurring. So it is complicated. And, I will tell you, all of us want to get back to restaurants and activities, as best we can, as quickly as we can. There's not a day that goes by that not one of us wishes that we were able to partake in any of those activities that are so important. But as Dr. Waco can allude to and remind us, is that the healthcare system is a very precious system in our country. We have to be very mindful that if you open up things and you think initially things are okay, unfortunately, if you don't have a methodical way of looking at things, you can see what's happened across the country, and that can occur anywhere. So we have to be really careful with our decisions. We have to be very methodical about how we make the strategies to come together and sync with each other. How we do that is laid out in the roadmap to recovery. And so, again, just the invitation to keep looking at that on a weekly basis, and we're doing everything we can to be transparent with the information, the data, and also to just lay out that what are those measures that need to improve in order to be able to get to the next phase. Dr. Wake, I don't know if you wanted to make a comment about the healthcare system and the importance of working together to protect it.
So you make a really good point, Dr. Shah. We did show that there was actually a peak post-Thanksgiving and post-Christmas and New Year's. We are starting to see a decline, but imagine that during that time, restaurants were closed. It did stretch our capacity. It didn't exceed our capacity, but it was really tight during that time period. And I, for one, don't want to return to that. I like the direction we're going in, and I think our phases are probably going to shift soon.
Yeah, and I'd like to add to this. So I look at these outbreak data since the beginning of this, and the number one outbreak category outside of long-term care facilities is restaurants and bars. And when they closed, we saw a decrease in these outbreaks. So for all the reasons Dr. Shah talked about, that translates into outbreaks across the state. Even with bars and restaurants closed, with takeout, we've seen 19 plus outbreaks in employees of restaurants and when there's takeout. So while there hasn't been any customer transmission, we still continue to see outbreaks in restaurants amongst the employees. So the data is very clear and the science is very clear. And unfortunately, that is what we are informing the governor, is on our science and our experience in Washington State.
The last thing I'll quickly add is that, as Dr. Shah mentioned, we very much want to continue forward on our pathway to recovery. That includes getting our businesses open. Our disease levels are still very high. While we are 45th or 44th in the nation, our level of disease is at among the highest levels we've seen over the course of this pandemic. So we've got to keep moving down the path, as Dr. Waco said, keeping our rates going back down, and not just reopening our businesses, but also getting our kids back in school. And this is, what Dr. Shah alluded to about being very careful and very methodical as we push forward to vaccinate as many people as possible, as quickly as possible, so that we can do all of these things sooner.
All right, thank you. Our next question comes from Will Stone with NPR.
Hi there. So I have just two questions, and the first is about navigating this 1B phase, which the governor touched on in his press conference earlier this week. Now that you've opened up the categories so much, and you admit, obviously you still have uncertainty about the supply, what does that do just for consumers? I mean, now we're going to have this mad dash for appointments. We've seen other states where there's frustration because so many people are eligible, and there's just not enough supply for that. Are you concerned about that? And the second is with this public-private partnership. Do you have a sense of how soon we'll see, meaningful results, kind of payoff of this in terms of the state vaccination rate?
Yeah, thanks, Will, for that question. Let me unpack the questions, and maybe Michelle and Lacey and Scott might have some additional comments here. But on 1B1, this has been again, it's either too much, too little, fast enough, too slow. The perspectives are really just very challenging. There has been no community or no state across the country that has gotten exactly, absolutely perfect. So we should strive for perfection, but what we really should be doing is striving for what the best information we have and to make those decisions. And so the reason that we felt that we could go to the 1B phase was because in the 1A phase, the healthcare workers, that we had enough of the healthcare workers, not all of them, but enough of the healthcare workers vaccinated that the opportunity for vaccinations now felt that it looked with the data that we could go into 1B. This is, again, the science. I would say there's a science of medicine and an art of medicine. There's a science of public health. There's an art of public health. And you don't always get it just exactly right, but you're doing the best you can. We were hearing from a lot of community members and a lot of partners who were saying, we're ready to go into 1B. Just open up, let us know we can go there. Some communities had even started going into 1B, we were hearing. And so it was really doing everything we could to balance both the healthcare workers and the long-term care facility work with also opening up to seniors and those in multi-generational households above the age of 50. I will say that, look, we've got a lot of people in this category, and the goal is to build our capacity up as much and ramp it up as fast and quickly as possible, so it is strong, nimble, and ready and appropriate and able to respond while we wait for vaccines to come into the state. What we do not want, and I don't believe Washingtonians want, is that if all of a sudden, from the earlier question, 2 weeks from now, the administration says, hey, we're going to give you more vaccine, and we're not ready then to receive it, and it takes us another couple of weeks to ramp up even further. That's not acceptable. So we are building that capacity right now in advance, so it's there, which means that we will get potential criticisms about, well, why did you build it up when you didn't have vaccine? Again, it's the art and the science, and also not having something exactly perfect because we're trying to balance so many different perspectives. So I'm just trying to be as honest as possible with you. I would say that when it comes to our business leaders, we're now having daily touch points with our business leaders. How quickly we're going to see results depends on what the different issues are that we're asking support from. It includes IT, it includes communications, it includes logistics, it includes process improvement, and even material support, things of that nature to improve and enhance the work that we're doing. Our mass vaccination sites are coming up on Monday. Part of how that success is going to be is really working also with those very partners. And so the success of Monday is what's happening in the state, what's happening in local government and local partners, but it's also working with our private sector. So that is what's also happening behind the scenes. So tangibly speaking, next week, as we are looking at these mass vaccination sites, that work of the business community coming in, that is going to be reflected in the success of those mass vaccination clinics is going to be reflected in the work that's happening behind the scenes with our public and private partners. Was anything else from our team? Okay, Frangie.
All right. Thank you. Our last question comes from Ryan Blevin with the Seattle Times.
Thanks for taking the time. I'm curious as to with the mass vaccination sites, the 4 around the state, why were those spots chosen, and are there plans for more locations? And then on another topic, in terms of some of the bumps in the road on the vaccine rollout, a lot of the problems seem to have to do with antiquated systems that DOH has been using, and this goes back through the problems earlier in the year too. What, Dr. Shah, are you going to be doing with the legislature to try to get the funding you might need to put in new systems? Is that a priority for you? And with this session, and given that this is, kind of the moment might be right to be trying to secure some of that?
Well, hopefully you'll help us, Ryan, with that, getting that message out. So, you've got a great, way of framing things. So thank you for doing that, Ryan. And I will accept your support on that. In all seriousness, absolutely. I don't want to just say legislature. It's really about the overall investment in health that is necessary in order to drive public health forward. So cornerstone values, as you know, when I came in, were equity, innovation, engagement. Innovation is absolutely critical, which brings in the technology pieces. I'm actually over the last few weeks, becoming familiar with some of the challenges related to information technologies and some of those systems that are maybe not as much antiquated, but they don't have the bandwidth to take on the volume of what we're asking those systems to do. So maybe in a normal time, their systems are fine, or they're okay, or we're not asking them to really stretch. But this is anything but normal times. This is a crisis. And so the crisis means that we have lots of volumes of information. We have a lot of folks who want to see that information. They want it visualized. They want it right now. They want to see it immediately. And it also helps drive decisions, right? So that decision making all comes back to data and technologies and visualization. Well, again, those systems, as they are now handling the mounds of information that they've never had or never been requested or asked to perform to that level before, that becomes the challenge. So as far as your question about asking the legislature, I'm still working through figuring out who do we ask and how do we work through that. So we've been much supported by the governor's office. As you know, the Foundation on Public Health services that the governor has put forth as part of his legislative package that also includes an infusion of dollars into state and local public health systems across our state. That's absolutely necessary. And we're hopeful that our legislative, our elected leaders across the state will recognize the absolute importance of public health and the fact that public health needs strong, nimble, as well as appropriate capacity in these data systems and technologies. And then behind the scenes, we're working with partners like Microsoft or like the Starbucks or like the Amazon or like the Costco's and fill in the blanks of additional partners that are really able to work with us and identify some of those additional solutions that are out there. So we're on this. This is very dear to my heart. One of the reasons that I was very much attracted to the state of Washington is because we have a high technology, high tech spirit, but we have to remember that it's high tech, but it's also high touch. We have to remember it's a balancing of what we do in technology with what we also do with individuals and people and communities. And we want to make sure that those technologies allow us to really accelerate and advance that work. So we are committed to it, Ryan, but I would ask you also to help support that because it is really very much about an investment in public health. We have not seen this kind of public health challenge in recent memory. And if anything, as we've seen the events of the last few days, as we saw what happened in Washington, D.C. with the memorial for all the lives that were lost, as we talked about earlier at the press briefing here about the 3,940 lives that have been lost here in the state of Washington, and the countless numbers that have been impacted, we have an opportunity to do better. And we will utilize that opportunity, but it's going to be up to all of us, whether we allow this to be a transformational moment moving forward, or we let this go by the wayside. So I'm committed to it. Our team is committed to it. But as you know, that this is going to take an all of us approach in order to be able to get this enacted. And so that's what we're committed to doing. And so Ryan, look forward to working with you on it as well.
And Dr. Shah, can I just emphasize something you're talking about for Ryan, and that is foundational public health. There has been a 5-year planning process for investing in the infrastructure of public health, including information technology. So this is not something new, Ryan. This is something that we have been pushing for 5 years. It just sometimes takes a pandemic to make it evident. So really appreciate you calling it out. That's the same message we've been delivering. And Dr. Shah is unfortunately inheriting the foundational public health service ask. So it's covered.
Thank you, Scott.
All right, thank you. This concludes the question and answer segment of our briefing.
With the Wenatchee World wanted to ask a question if that's at all possible.
I'm sorry, who's this?
This is Tony Burr with the Wenatchee World newspaper.
Go ahead, Tony. We're over time, but we'll give you the last question. How's that?
Okay, I really appreciate it. Thank you so much. We were just really curious about vaccination sites, particularly because of the Town Toyota Center. It seems like the local health district and the Town Toyota Center itself are unaware that there are going to be a vaccination site. So we're just kind of curious what the plan is. Is the DOH going to be handling that? Is the National Guard going to be in control of that? And will people just be driving up to get vaccinated, or how does that work?
Yeah. So Tony, let me just give some general comments, and then Lacey and Michelle and Scott may have some additional thoughts here, because I know that Dr. Lindquist, for example, has spoken with the public health folks in the various communities that were standing up the mass vaccination sites. What I would say is that we are working through all those plans, and I don't want to give all the, here's what it's going to be, because there may be some additional pivots with this. But I will say that things have been moving very fast, and while we have done our best to communicate, it's a two-way street of communication, that sometimes we say something and it may not be, we're saying it to the right person, right entity, and or it's not shared across the board, or maybe it was just not heard in the same way that we intended. So our goal is to continue that communication, that partnership. As Dr. Waco on this press briefing can attest to the fact that at the end of the day, it is not perfect, and we have work to do at Department of Health, and we're committed to it to make sure that we get communication even better, not just with our public health partners, but our healthcare partners, our providers, and everyone in the system. As far as that specific site goes, one of the, as Dr. Lindquist mentioned a bit ago, these are not brand new discussions related to mass vaccination efforts. We have plans in place that have really looked at how would we stand up mass vaccination sites across the state if we were to get into a situation such as we are today. And so these are not just, you just snap the finger and boom, there you go. Now you've got a mass vaccination site that's identified, but it's really careful planning that's been months, if not years in the planning. And we are really now executing or implementing those plans. So again, really a lot of this is moving and pivoting. And I'm sure that as we get through this press briefing in 15 minutes, we'll have another change to the plan. So until we've had that all finalized and worked out, we don't want to really move forward with announcing this is the way it's going to be. It's going to be a drive-through, a drive-up, or walk-through, or walk-in, walk-up. We want it all to be really all defined as and final before we lay that out to our community members. But that is our goal to do so this coming weekend. So with that, Dr. Lindquist and others.
Yeah, and I want to clarify one of the points you were making. I personally called health officer and administrator in each of these counties to tell them about the governor's announcement. So it wasn't that they didn't know this was going to happen. I think it's, as Umair is saying here, it's the devils are in the detail of where it was, like the Toyota Center, et cetera. I think that's where we need to coordinate with them and be really clear about what the details are. So they all knew about this, just to be clear.
And, I can add just really quickly, our team at DOH is working with the Chelan Douglas Health District on the logistics, and that site will be supported by National Guard. So things are moving quickly. This is the level of effort that it's going to take to vaccinate the number of people we need to vaccinate in Washington. And, that added on to the supports we're getting from the private sector.
And I will quickly add, while I'm not participating obviously in the Wenatchee project, we have partnered heavily with the Department of Health, and they've been very accessible to us and have helped us extensively as we've worked through their processes. But setting up a mass vaccination clinic is an incredible amount of work. It is fast, it is furious. There is tons of communication that's going back and forth, and things change right up until the last minute. So I think that this is actually still early to learn about communication for something that's occurring on Monday.
All right, thank you. This concludes the question and answer segment of our briefing. And now we'll go to Secretary Shah for closing remarks.
First of all, let me thank all of you for being on this morning, and just for everything you're doing to get the word out to our communities. We know that communication and really getting information out to community members, Washingtonians across the state, is absolutely critical. We have to continue to work through all the challenges and sometimes confusing information that is out there. I do want to thank Dr. Waco for joining us today. Thank you for your comments. Thank you for your not just leadership, but also your boots on the ground for assuring that we can fight this pandemic, including with vaccinations, into the arms of Washingtonians. So thank you, Dr. Waco, and everything that you represent, your team represents. So I wanted to give you a special shout out there. I also want to thank our team for the incredible work that they've been doing. I know the governor has, and I have. We've been pushing our teams very hard, and they're definitely rising to the occasion, but they are doing a lot of work behind the scenes, and I cannot appreciate enough the efforts of Lacey and Michelle and Scott and all of our communications folks and all the folks behind the scenes that are doing everything that they can to fight COVID-19 on behalf of Washingtonians. It is not easy, and people do not want to hear that it's not easy. It is just the reality of what the work and the challenges that we have ahead. However, that said, we are confident we are going to continue to move forward in a very aggressive way. We are working with our federal partners to find out as much information about increased vaccine supply for our state, and certainly doing everything at the state and local levels to work with our partners so we can get Washingtonians vaccinated as quickly as possible. Again, the goal is 45,000 Washingtonians vaccinated per day. That's the capacity goal that we have in the short term. And we are looking to triple where we are right now of 15,000 vaccines a day. But let me close by saying that, again, today is the 1-year anniversary of the first case confirmation in the state of Washington. As Dr. Lindquist pointed out, there are so many partners, so many people, and so many community members that have been impacted throughout this year, that have been working with us and alongside us with everything that has been up and down and twists and turns with this COVID pandemic. It is not easy for anyone in our state, and we know it's going to take time before we can move forward and find sense of normalcy as a state, but we will get there. So again, at noon today, we will be honoring the 1-year anniversary. We would ask all Washingtonians to also do so, either at noon today or sometime during the day today, for both the lives that have been lost, but also the lives that have been impacted, the communities that have been impacted by this pandemic. So with that, I just want to say thank you. We'll have more information about our vaccination sites and all the other activities. Please continue to watch us on social media. Please follow us on social media and our website, and look forward to additional conversations as we continue to move forward with this effort that is underway and will continue to improve over time. And so with that, Frangie, we'll close the briefing.
Thank you. This concludes today's media availability. I'd like to thank our panelists for their time today, and also TVW for hosting today's live stream and archives of past briefings. Thank you all, and take care.